three muscles related to the thoracic wall. Number one is muscles of the upper limb. There are 10 muscles related to the upper limb and thoracic wall as well. That's all: pectoralis major, trapezius, serratus anterior, pectoralis minor, latissimus dorsi, levator scapulae, rhomboid major, rhomboid minor, and two serratus posterior superior and inferior muscles that are related to the upper limb, and we can see part of these muscles to the thoracic wall. Another muscles of related to the thoracic wall is about abdomen. Rectus abdominis and external oblique muscles are two example of the abdominal muscle of the abdomen that's related to the thoracic wall. And also muscles related to the back, for example erector spinae, sacrospinalis, is related to the thoracic wall in the back. In addition to the muscles listed above, a number of other muscles of the abdomen and of the head and neck are attached to the margins of the two aperture of the thorax. So how about thoracic wall proper? This table shows us about intercostal muscles that are thoracic wall proper muscles. We have three muscles just related to the thoracic wall: external intercostal, internal intercostal, and transversus thoracis muscles that is subdivided to subcostalis, intercostalis intimi or innermost intercostal, and sternocostalis muscles. So we have three intercostal muscles that are related to the thoracic wall. As you can see in this table, the origin of the insertion of these thoracic wall muscles are differ. For example, external intercostal muscles origin is lower border of the rib above the space, and insertion of it is outer lip of the upper border of the right rib blue. For internal intercostal, origin is floor of the costal groove of the rib, and its insertion is inner lip of the upper border of rib blue. And about transversus thoracis and subdivision of it, for example, subcostalis origin is inner surface of the rib near the angle middle 2/4 of the rib ridge above the costal groove, and its insertion is inner lip of the upper border of the rib blue. For innermost or intercostalis intimi, insertion is middle 2/4 of the ridge above the costal groove, and insertion is inner lip of the upper border of the rib blue. And for sternocostalis muscles, origin is lower 1/3 of the posterior surface of the body of the sternum, and also posterior surface of the xiphoid, and posterior surface of costal cartilages of lower third to 4 true ribs near the sternum, and its sternocostalis insertion is costal cartilages of the 2nd to 6 ribs. In the next shape, you can see here external intercostal muscles, internal intercostal muscles, and innermost intercostal muscles. As I said before, the thoracic cage forms the skeletal framework of the wall of thorax. The gaps between the ribs are called intercostal space. They are filled by the intercostal muscles and contain the intercostal nerves, vessels, and lymphatics. There are 9 intercostal space anteriorly and 11 intercostal space posteriorly. And intercostal muscles are external intercostal, internal intercostal, and transverse thoracic muscles. Internal intercostal muscle, which comprises intercartilaginous in front and interosseous in posterior lateral part, and transverse thoracic muscles, which is divided into 3 parts, as I said before in the last slide, namely subcostalis, the intercostalis intimi, and the sternocostalis. Here I'm showing to you the extent of these muscles from anterior to the posterior. The external intercostal muscles, that is in red color from anterior to the posterior, extend from the tubercle of the rib. Where is it? Do you know? Do you know where is it, the tubercle of the rib? Yes, exactly. Here is in front we have a sternum, and in the posterior we have a vertebrae. And the tubercle of the rib is near to the posterior aspect. So we have a head, neck, and tubercle of the rib. So the external intercostal muscles extend from the tubercle of the rib like this shape posteriorly to the costochondral, here costochondral junction anteriorly, from the tubercle of the rib posteriorly to the costocartilage joints anteriorly. Between the costochondral junction and the sternum, here it is replaced by the external or anterior intercostal membrane. External intercostal membrane. The posterior end of the muscle is continuous with the posterior fibers of superior costotransversus ligaments that I said before. The internal intercostal muscles extend from the lateral border of the sternum, like this one, lateral border of the sternum, its origin of internal intercostal muscles, to the angle of the rib, Here is the angle of the rib, 5 centimeter, lateral to the tubercle we have an angle. Here is the end of the posterior part of the internal intercostal muscles. Beyond the angle, internal intercostal muscles become continuous with the internal or posterior intercostal membrane. Internal intercostal membrane, which is continuous with the anterior fibers of the superior costotransverse ligaments. So, look at this picture. This is about subcostalis muscles. The subcostalis muscles is confined to the posterior part of the lower intercostal space only, and the intercostalis intimi is confined to the middle 2/4 of all the intercostal space, and the sternocostalis, here it's a part of the transversus thoracis called intercostalis, sternocostalis, is present in relation to the anterior part of the upper intercostal space. So the last question is about how we can describe the direction of the fibers of the external, internal, and transverse thoracic muscles. Can we recognize these muscles from their direction of fibers? The answer is yes. The direction of the fibers can tell us about which intercostal muscle is. For example, in the anterior part of the intercostal space, like these pictures, in the anterior part of the intercostal space, we have intercostals between upper and lower ribs. The fibers of external intercostal muscle run downward, forward, and medially in front, like when you put your hands in your pockets, exactly like this. It's about external intercostal muscle. And the fiber of the internal intercostal run downward, backwards, and laterally. And the fiber of the transverse thoracic run in the same directions as those of the internal intercostals. So innermost and internal intercostal muscles are same, but external intercostal muscles is different from all of them. In the summary of these lessons, I expect you should explain the ribs, describe typical and atypical ribs, name the joints and their ligaments, and also explain first, second, 11th and 12th ribs specification. And I expect you could describe sternum and its attachments and name layers of the thoracic wall and muscle. For more study, you can use different references. You can use Gray's Anatomy for Students. You can use Snell Anatomy, and also you can use Human Anatomy, right, by Thoracia. That's end of this lesson. Take care and see you in the third lesson.